How's everybody doing? I am Miller Rogen. I am a filmmaker, I am a CIRM board member, and I am a patient advocate. I am so very honored to be here today at the CIRM Alpha Clinic Symposium on the cusp of the 20th anniversary of the California Institute of Regenerative Medicine. 20 years, it's amazing. It is so inspiring, really, to be in a room full of people who are dedicated to changing lives by advancing science. Our home, California, as you know, is a global center of biomedical innovation, and many of you have been instrumental in driving breakthroughs forward. CIRM and the Alpha Clinics Network exist to accelerate this work, ensuring that these innovations reach patients faster. Your efforts, whether in research, advocacy, caregiving, or patient support, represent hope for so many people and families waiting for breakthroughs that will change their futures. Personally, I know about that hope that the patients have. It's hope that I held on to when I found out that my mom, Adele, was diagnosed with early onset Alzheimer's at only 55 years old. My husband, Seth, were in our 20s at the time. We were very far from prepared. Honestly, I don't think anyone could ever be really prepared for someone you love to disappear into a disease like Alzheimer's. But we were quite young, we were scared, we were facing something that would, of course, change our lives forever. I'll never forget the first time that I decided to attend a support group for caregivers. I had finally mustered the courage to go, only to find that I was the youngest person in the room by decades. Everyone else was caring for elderly parents, spouses, while I was there because my mom, who was a teacher for 35 years, was slowly slipping away. There was no space for someone like me, a younger person, still figuring out my own life while grappling with this very impossible situation. I felt so completely alone. So we formed an organization called Hilarity for Charity, which is HFC for short, we call it now, and it's dedicated to supporting families impacted by Alzheimer's disease and related dementias, activating the next generation of dementia advocates, and being a leader in brain health education. In the 12 years since we first began, we've raised more than $23 million to advance our mission, and fortunately and unfortunately, I realized I was very far from alone. Also, a few years ago, I faced my own health scare, a cerebral aneurysm. I was diagnosed after a routine full-body MRI scan and told that it was small. I don't need to worry about it as long as it doesn't grow. For a few years, of course, it did not grow, and then it did. And suddenly I was filled with fear. What would I do next? What were my options? How would this be handled? What is going to happen? But thankfully, I was in the hands of one of the best care teams in the world at UCLA, in the state that is leading the world in biomedical innovation. The whole experience was surreal, equal parts terrifying and humbling, and I remember thinking, I am so lucky to have excellent care. My experiences on both the caregiver and patient side made me realize how vital access to the right care truly is. Not everyone has the same access to expert care, and that's why patient access advocacy programs are so important, and why CIRM is so important for funding these vital programs. In 2013, I joined CIRM, the CIRM Governing Board, the Independent Citizens Oversight Committee, as a patient advocate for Alzheimer's disease. My involvement was fueled by my belief in CIRM's mission and its drive to bring new therapies to communities across California. CIRM's funding and support are really pushing the boundaries of what's possible in science. The breakthroughs that we're seeing in cell and gene therapy hold incredible promise for the future. I can imagine a world where incurable diseases like Alzheimer's or ALS are curable. My family, like millions of others, would benefit from these breakthroughs. That's the world we're working toward, and CIRM will play a pivotal role in leading the way. It's through CIRM's Alpha Clinics network that cutting-edge therapies like cell and gene therapies actually reach the patients who need them. These clinics are among a select few in the nation, and the expertise and capacity to deliver these groundbreaking therapies. With collaborative partnerships, the Alpha Clinics are actively conducting clinical trial research for life-changing treatments for communities statewide. By focusing on patient-centered care and research, the Alpha Clinics are ensuring that clinical trials meet the highest standards while promoting accessibility and, of course, inclusivity. CIRM is now setting out to build on that commitment by creating the Community Care Centers of Excellence, a future program that will establish geographically diverse and culturally responsive centers of excellence to support access to clinical trials and approve regenerative medicine treatments. These centers will serve as a hub for expanded access to therapies, as well as education and training programs to even more communities throughout California. Further, they will develop the expertise and capacity necessary to deliver the emerging pipeline of cell and gene therapies. The expansion will enable the field to grow while improving equitable access to clinical trials and potential therapies in geographic areas that have historically faced barriers in healthcare. But having world-class clinics capable of delivering life-saving therapies is not enough. Clinical trial patients often face financial challenges, long-distance travels, and family commitments that can make it difficult to maintain participation. I can remember these challenges all too well when caring for my own mother, who participated in a clinical trial that was administered over an hour away from my parents' home. We need to make sure that Californians who need these treatments can get them regardless of who they are or their ability to pay. Proposition 14 recognized this need and established a dedicated fund to support patient participation in clinical trials and access to approved treatments. This fund will be deployed through CIRM's Patient Support Program, an initiative designed to get us one step closer to that vision. It's important to remember that programs like these don't stand alone. They are part of a larger ecosystem that CIRM has carefully and thoughtfully built. Through its work, the Alpha Clinics have become a model for many of CIRM's other programs, serving as a foundation for broader initiatives like the Patient Support Program and the Community Care Centers of Excellence. These programs are critical to achieving CIRM's mission. They demonstrate CIRM's commitment to not just advancing science, but ensuring that scientific breakthroughs are accessible to everyone, no matter where they live or what their circumstances may be. And none of this can happen without collaboration. That's why we're here today. The work that all of you do, whether it's as a researcher, clinician, advocate, or someone working behind the scenes, plays a critical role in moving the needle forward. As someone who has been through the heartbreaking journey of losing a loved one to an incurable disease, I can tell you that hope is one of the most powerful tools that we have. The work being done by CIRM and the Alpha Clinics give people hope. Hope that someday families like mine won't have to face the devastating reality of diseases like Alzheimer's. Thank you so much for being here, for your dedication, and for your commitment to advancing science. Know that your efforts are helping to make regenerative medicine a possibility for everyone. Thank you.